Hello and welcome to Fresh Perspectives. My name is Gail, and my guest today is somebody that those of you who are at an age where you get Medicare are going to really like him. And his name is Paul Reidenouer, and he has a business called Senior Benefits of New York. Thank you for coming on, Paul.
Thank you, Gail. Thank you.
Oh, you're welcome. And now, Paul, what kind of an education did you have to get to do this kind of work?
Well, in order to sell insurance in New York State, you have to take the, first of all, you got to get licensed. There's a study course, a certain amount of hours you have to study, and then you take the state test for both life insurance, health insurance. I don't do property and casualty, but they have to do the same thing for like car and homeowners insurance. So we have to be certified, I should say licensed. But then after that, when it comes to Medicare, Medicare has additional regulations for us. So once we get contracted with the specific companies, before we are considered labeled ready to sell, we have to do their certifications, and we have to do that yearly. For us brokers, we are what's called AHIP certified, where you cannot sell Medicare programs unless you're AHIP certified as a broker, and you do those of us that offer multiple companies. So, and then each Medicare company, after we're AHIP certified, they have their own certifications that we have to take and pass a test every single year.
Oh, okay. That's like when I worked for the Resource Center. We had all of these things we had to learn how to do to work in a group home, and we had to take refresher courses and everything every year.
Yeah, when it comes to life insurance and annuities, there's additional tests and certifications we have to have also.
Okay, okay. Now, according to your business card, you help people decide what to choose for Medicare options, life insurance, and annuities, all three of those things that you work with. Okay. Let's talk about the Medicare options first. You represent most of the plans available in our area.
I do.
Would you mind telling the viewing audience which ones those are?
I represent United Healthcare, Blue Cross, Univera. Blue Cross is now Highmark. If they see Highmark, it's Blue Cross of Western New York. Aetna, Humana, WellCare.
Okay, so those several then. Well, there's other insurance companies available in our area that you don't represent then.
Well, Independent Health, I believe, just started using limited brokers. They never did before.
Oh, I see.
And then MVP, that may be changing for me soon, but MVP is one of the other companies at the moment I don't represent.
Oh, okay, okay. Let's see. What steps do you have to take to determine which plan is best for an individual?
When I sit with an individual, number one, I have over 30 plans. I don't come in with 30 plans and completely confuse them, because Medicare in itself is extremely confusing for individuals. So it's having a conversation, talking with them and trying to find out what their health concerns are, what their needs and what their preferences are. So once we get through the health concern and we kind of get an idea, okay, is dental important or is eyeglass coverage important to you? Then we also have to look at, okay, who are your doctors? What are your prescriptions that you're taking? Because number one, me personally, I don't just put someone in a plan because I like that plan. I need to make sure their doctors are part of the network. The last thing I need is someone enrolling, say, into a plan in March, and in the middle of March calling me and telling me their doctor doesn't take their plan. That doesn't do them any good. The second thing is the cost of prescriptions. That is one of the biggest concerns. As we all know, prescriptions are expensive. So I try my best to try to find them the plan based on their scripts that they're taking now to get the lowest cost. And sometimes that includes me looking at other alternatives for them to reduce their insurance costs, like prescription assistance programs.
Okay. Yeah, I know that you came to our house one day in November and helped us figure out what we were going to do for 2022. So, would you like to give some examples? Of course, you won't be mentioning anybody's names, but can you give some examples of how you help some people?
Well, yeah, I mean, some people, now we have this insulin saver program. And not every company is participating with the insulin saver program, where they will pay no more than $35 for insulin. It's not subject to the deductible nor the donut hole, where their costs typically increase at some point. And in those cases, I helped individuals who are paying a lot of money. They're ended up in the donut hole, and their insulin all of a sudden is $150, $200 a month, where we were able to move to a different plan, and they were able to get the insulin saver program, and that saves them quite a bit of money. Other instances where individuals' health has changed, or they've come into, say, chemotherapy, radiation, maybe due to cancer. Well, in that case, I've helped individuals sit down and say, okay, this is what it's going to cost on a Medicare Advantage plan, but on a Medicare supplement, it reduced their costs greatly, where they almost had zero out of pocket for chemotherapy.
Wow.
And in those situations, I've been able to help them. I mean, every situation, what I love about doing this is every home I go into, and the great people that I get to meet, every situation is different. Everybody's needs are different. And there's not one, I should say, all the Advantage plans are fairly close. But in some cases, there's certain plans that are better for their situation that they're in, or their preference that they have.
Well, I remember when you came to our house, I had Univera supplement plan for the last 2 or 3 years. And after talking to me for a while, I remember you asking me if outside of natural health therapies and the dentist and the eye doctor and like that, if there were any other specialists that I see. And when I said no, you suggested that I switch over to the Highmark Blue Cross plan, which is what I have now.
Right.
So mainly because I just don't have a bunch of health issues.
Sure.
So
when you bring that up, that reminds me too, is there's a lot of, you see zero premium plans out there.
Right.
And there's a lot of, every company has a zero premium, but every company has a premium paying plan. And some people out there are paying $100, $200 a month for a Medicare Advantage plan that is just like the zero premium. The only difference is few copays might be lower, but they're prepaying and giving the insurance company $1,200, $2,400 a year, and still have to pay $15 for, $35 for a specialist,
right.
$5 for a primary, when it's the same thing on a zero plan. So that's another area that I've been able to help, is reduce their cost, where a zero premium compared to a $100 premium, there's not much of a difference in there, and they've just saved $1,200 or $2,400 a year in premium.
Oh yeah, it can be awfully expensive. I remember for a long time, I think I was on independent health when I first went on Medicare, and I got switched to Univera, I remember, because I found out that all of a sudden one year they wanted to switch the zero premium plan to paying $50 a month for the prescription coverage. Well, I don't take a bunch of drugs. I'm not on any of those age-related medications that a lot of people my age are on. So it would never be worth it to me to do that. And there was another thing about the Highmark Blue Cross thing that you helped me get switched to, and that was something about it. There were two different ones without a premium, and one of them was that every month, the money that gets taken out of the Social Security payment for the month pays $50 of it back.
Yes.
Would you explain that to the viewing audience?
This year, you saw more companies create a new plan that literally put money back in their Social Security check. In a sense, they're literally paying you to be part of their plan because they're putting money back in the Social Security check. There's no strings, there's no qualifications for that. It ranges anywhere from $25 a month. Some of the companies are doing $35, $50. One is doing $74 a month. Where what happens is you get into that plan, all of a sudden your deduction is less, therefore your Social Security that's going into your checking account is increasing by $25 or $35 or $50 or $74 a month based on the plan you go into. There's no qualifications for that, but here's what happens. I'm not saying those plans are bad. For an individual that is not a big user of their plan, then they're going to make out, because even though the co-pays are higher on those plans in some cases, because they got to pay for giving you money every month. If they're not a big user, then they're going to come out ahead on that. But even though it's nice to think you're getting more in your Social Security check, you want to step back and take a look at the whole picture. Is it worth it? Is it worth paying more co-pays? Is it going to be a wash in the end? It can be a benefit, but it can be a gimmick at the same time. So you really got to look at the plan to see if it's right for you.
Oh yeah,
Yes,
yeah. So you're very, very careful when you
Right.
recommend, because I see they still had the choice of the one where they didn't give you $50 back.
And the co-pays were less. So some of them will have 2 zero premium plans. One that doesn't give you money back in your check, one that does. And I'm not saying the one that does that their plans are bad, but for example, let's say the one copay is $5, but the one that gives you for primary care doctor, but the one that gives you money back in your check is $15. So you got to just see if it's worth it. If you're not a big user of your plan, they can be worth it. Yeah, you're paying more, but in the end, I mean, really, the one company's literally giving you $600 for the whole year. If you don't spend that in co-pays, you come out ahead on that plan for that year.
Yeah, oh yeah,
Yeah.
yeah. Well, you know, it was funny. I got a survey in the mail the other day. I was mentioning it to you on the phone, but I thought the viewing audience might like to hear it. And I got the survey from Univera, who I had through 2021. You know, and it was, it's kind of like they're disappointed you switched from then. But they want a section of the survey, which I have not filled out and sent in, is because I won't be needing to use, this is February now. We're in the second half of February. And this year so far, I have not had any appointments or anything.
Sure.
No
Good for you.
prescriptions or anything. I have an eye checkup and just a regular medical checkup. Let me think. I think I might have. Well, I can fill it out and send it back to them after I have these appointments.
Sure.
There's no way I could. They wanted, to put down, like a score, for each of these different things. And the thing of it is there's no way of knowing what the answers are until I go to these appointments.
Right, yes.
Then I can fill it out and send it in. And there's a question on it like, what would we have to change to get you to come back to us next year or something like that,
Yep. Yeah, what's happening now is they're sending them out, a lot of the companies, because this is the time they're coming up to submit their plans to CMS for next year. So they want to kind of see what they can do. But I'm glad you're not a big user of the plan. That means you're healthy and you're doing well. Good for you.
Yeah, so, well, it really pays to take good care of yourself.
Absolutely.
We talk about that a lot on Fresh Perspectives.
Yes, but
So-
I've heard it many times. I mean, really, your health care starts in your kitchen. I've heard that many times.
I remember there was this one speaker, we had to come to one of our vegetarian vegan society dinners one time, And I remember the guy that came to speak, he was going, how many of you have a health care plan? And just about everybody's hand went up in the air. And then he asked, and I think it was, maybe he just said HMO or something like that. And then he asked a question, something about, how many of you consider this your health care plan? And it seems like everybody's hands stayed down, because everybody who was there, you know, was the kind of person who wants to take good care of themselves, so that they don't have to be going through all kinds of medical issues that they wind up having to deal with. So
I'm trying to eat better. I love pastries and ice cream, so I'm having a hard time.
No. Get yourself a machine called a Yonana. You can make banana ice. It's made specially to make banana ice cream. It's like you let them get really, really ripe, and then you peel them and freeze them. And then, like about 15 minutes or so before you want to make the ice cream out of it, I mean, it tastes perfectly good without all of that added sugar or anything.
You know, I think we have one. I remember us doing it, but I think my older daughter took it when she moved out.
Oh no. Well, you have to get another one, but you know,
my grandchildren would like it.
All you have to do to make it chocolate is, during that 15-minute thawing time before you put it through the machine, is have cocoa powder sprinkled on top of it, and no sugar.
Right.
And, you know, without any vanilla extract, you just put those bananas through that have cocoa powder on it, and that's the best tasting chocolate ice cream. It really is.
I know my grandchildren have fun just putting the bananas in it.
Whether they eat it or not.
I think they would, but they'd have fun just doing that.
You'll have to get another one.
Yes.
Yeah, and then what was the other thing that you said that you like?
Well, pastries. I like to bake. And right now my baking partner is 4 years old. And so I like to bake, and I got 2 other grandchildren coming up, and I got to have them become my baking partners too. So I'm actually bought, as we get I'm getting off subject here, but I actually bought a machine to grind my own wheat berries. And I want to start teach me as well as my grandchildren, we want to make bread, and so I want to try it in cookies, and so I want to try that.
I'm an experienced bread baker myself. So as long as you're using like whole grains. Yes. Okay. Now, one of the guys here that works at the studio, he brought this up right after Paul got here. And I wanted to bring it up about saying something about those, you know, the postcards that come in the mail to try to tell you to call about Medicare information, and then there's advertising on TV. There's famous people like Joe Namath, you know, that are telling you to call a certain phone number and things like that. And I want you to say what you know about those things.
Well, first of all, if I could afford to hire Joe Namath to get him off TV, I would. J.J. Walker, I wouldn't, because I loved watching that show as a kid, but I don't know if I could handle him saying dynamite every time in my office.
Yeah.
But those commercials, they're marketing. You know, they're fairly deceiving. They will tell people, based on your zip code call, you may be able to get money back, or you may get certain benefits based on your zip code. A lot of that is to make people think, my gosh, where I live, there's benefits I'm not getting. I need to call and see. They make it sound like dental is brand new. They make it sound like eyeglass and hearing aid coverage and gym membership and all this stuff is brand new. It's not. It's been on these plans for years. The most confusing part of those commercials is call now because you might be able to get $190 140, well now they say 144, that commercial is 2 years old. But the Part B premium for Medicare, last year was $148.50. This year people are paying $170.10. That gets deducted from their Social Security check every month. And they think they make people believe that they can be eligible for that, and you got to call. Their whole point is to get them to call so they can switch their plan over the phone.
Oh, okay.
Because I don't know the percentage, but you have to qualify financially to get the $170 put back in your Social Security check. The program is called Medicare Savings Program. And if you qualify, DSS pays your premium for you. It is a version of Medicaid. It's not full Medicaid, but it's a version of Medicaid. So that is fairly deceiving. Now, I do help people apply for that program to get the $170 back in their check. Once we talk about income and we make sure that they could possibly qualify. And I do that. I don't charge anybody to see and help them apply to get that put back in their check. But that's the deceiving part of some of those commercials. But here's the other problem is, you're getting inundated with these commercials and everything in the mail, and you start thinking, you know what, maybe I better call that number. Maybe I'm missing something. Mm-hmm. Well, they call the number. They're talking to somebody, whether they're in the country or not, or wherever they are in this call center, and they're talking about the plans. If that individual answers a question a certain way, they may not be aware that they just authorized them to change their plan. And next thing they know, they're getting cards in the mail, and it happens all the time that I get phone calls from clients telling me, I don't know how I got on this plan. Mm-hmm. And I start asking, did you call a number? Did you speak to someone over the phone? And that's what happens. Mm-hmm. And it happens a lot, and it messes people up where we have to switch them back. And hopefully there's an election period with Medicare that we can switch them back into their plan and not have to wait till next year.
Oh, yeah.
It's confusing. The stuff that comes in the mail, most importantly, the people that are within 3 to 6 months of turning 65, they are being inundated with almost constantly. Now, a lot of those postcards that come, they want to be careful also. In all honesty, a lot of us brokers do these mailings. But let me just say that some of them that go out look like they're from Medicare. They're not from Medicare.
Yeah, they indicate like that they are.
Yes.
You know, it's
yes.
like you feel like Medicare has mailed you something.
Yes, and it kind of goes along with those commercials where getting more benefits, they make it seem like it's Medicare telling them that they could get more benefits, you need to call. It's not. And when you have a local agent, you have an agent that is, number one, what that company is considered your agent of record. It's somebody you can call instead of calling customer service all the time. You can call your agent, you can talk to them. Many times I personally have gotten on the phone with my client on a three-way phone call, and I was on the phone with them with customer service to straighten the issue out. Oh. Instead of having them, because there's not everything, we can't handle everything. Some things we have to go through customer service. And I don't want my client being on customer service and without me sometimes based on the issue, because someone that's living by themselves or maybe a little confused or not sure what's going on, I don't mind being on the phone and helping them.
Yeah, it can be hard to understand when you're talking to somebody on a phone from somewhere. I'm not talking about like the insurance companies, but just any situations,
Yeah.
It can be really hard to comprehend what some of these professional people are talking about.
You're right, and the reality is, that calls are being routed overseas. That's the reality. Some of the companies are. And the problem is on the senior end, sometimes they just have a hard time comprehending. It's nothing against the person on the other end of the phone. They're just having a hard time comprehending.
Right.
And that makes the anxiety and the stress level even higher, because there might be a serious issue that they need to get straightened out. That's why I don't mind being on the phone with them with customer service to help them.
Yeah. Yeah, well, I'm glad there are people like you who are willing to do that. And now, I've lost my train of thought.
I hope I answered that question enough regarding the TV and the.
Yeah, I hope so too. I think so. But anyway, yeah, anyways, it's like, don't call those numbers, basically, is
Right.
your advice.
Right, because the whole goal is to really just switch them to a plan. A lot of times, here's another thing that happens. I mentioned earlier, when I sit with someone, I check their doctors. I don't take anything for granted. I check their doctors, I check their prescriptions. You're not guaranteed that with someone on these phone. The whole goal is to get an application, to enroll someone. And many times they are not checking doctors. And that creates a whole nother problem.
Yeah, and could this be somebody from a certain insurance company that might be the person that answers the phone?
A lot of times they're call centers from
Call
brokers, national broker companies that have very large groups that have call centers that just call over the country. Typically, they are not local centers. They're literally just large call centers that these companies use. They may pay them an hourly wage, but it's just a huge call center. And that's what's happening. I'm not saying insurance companies aren't answering it sometimes based on their individual personal ads. If the ad is specifically from whether it's United or Aetna or Blue Cross, it's specifically their ad, more than likely it is them that you're calling directly.
Oh, yeah, okay. So now what is the reason people don't just have just plain Medicare? Why do we sign up for these supplement plans? Would you explain that to people?
Because, well, Medicare is decent coverage, but it doesn't give you any, number one, it doesn't give you any additional. It doesn't provide you assistance with dental, eyeglass coverage unless you have cataract surgery. It doesn't help you with that. People benefit from the gym membership being paid for. Also, too, is Medicare does not have a cap. Medicare, your 20% that you would pay on Medicare, there is no cap. The Medicare Advantage plans have a cap, whether in Western New York it ranges from $4,800 to $7,550. People may see that on their plan. It's the max amount of pocket. What that means is if you have a terrible year, there's chemotherapy, there's a lot of hospitalization and doctors. Once your copays, it's not a deductible you pay up front. Once your copays equal, say, $7,550, the remainder of the year your medical is zero. Prescriptions are not part of that. So it saves the individual from getting $15,000, $20,000, $30,000 in medical bills.
Or more.
Right.
I mean, you get 50,000, 100,000. I mean,
That's right.
There
Yes.
are people who have so many serious health problems that they just probably go bankrupt, I figure.
Right, and the other aspect is hospitalization. Under Medicare, whether you're in the hospital for one overnight stay as an inpatient or 60 days, Medicare has a deductible of $1,556. Well, on a Medicare Advantage plan, you don't have that. You may pay a daily copay for the first 5 or 6 days. That could range from, I'm just going to give a ballpark, $300 to $400 a day. But if you're there for 10 days and your plan says 5, you only pay for 5 days. You don't pay for 10 days. So if you're there for 20 days, you're only going to get a bill for 5 days. So there's some limits there also. So if you're there for 1 day or 2 days, instead of getting a bill for $1,556, you're going to get a bill, say if it's $300 a day, for $600 if you're there for 2 days. So there's a savings there. Also under Medicare, or Medicare Advantage I should say, there's set copays. So you do know what your services are going to cost you under a Medicare Advantage. Also within the Medicare Advantage plan typically includes the prescription drug coverage, all on one card.
So actually, you could wind up, if you had just plain Medicare, you could wind up owing a lot of money that you wouldn't be able to afford to pay.
You could. I mean, at 20%, based on what's going on, yes, you could. Absolutely.
Yeah, well, that's too bad. But anyway, shall we move along to the life insurance
Sure.
that you do? What insurance companies do you represent?
I represent, New York is limited companies. New York State, a lot of life insurance companies do not want to do business here in New York. So I represent American National of New York, Foresters, Royal Arcanium, Gerber, Prosperity. If there is a company that the rates are better, then I will go out and get that contract. They get licensed. It's a nice thing about being a broker. We have companies we deal with, and if there's other companies we need to bring in, we can by getting contracted with them.
Well, I've never even heard of any of those companies that you just mentioned.
Yeah.
Actually.
Well, a couple of the, like for example, companies like Royal Arcanium or Foresters or Prosperity, they're bigger in what they like to call final expense. Many individuals, say in the senior population, don't even have any life insurance for burial expense. So they put a name on it called final expense. So those companies are very competitive. They got specific programs where you don't need blood work or physical. A lot of times it's answering the questions on the application along with a phone interview. With me there with the phone interview with the company. It's much simpler underwriting, where people that go for typically, say, like term insurance, $100,000, they might not let so many things go. But for someone going for like a $10,000 policy, the underwriting's different. So that's kind of where I can help someone with life insurance of any age, but one of the markets is final expense. Helping individuals get enough money to either take care of their final expenses so their family doesn't have to take care of it when they pass, or some want to leave a little legacy to children or grandchildren, and they may pick up a policy for that.
Well, I know that certain life insurance companies always try to get you to start talk you into paying more and more, and they want to make you feel guilty, like if you don't take out enough insurance for more than the actual funeral. Then they want to guilt you into taking out more insurance so you can leave money behind for the family that gets left behind, to help support them or whatever. The only thing is, if you spend all of your money on insurance, you don't have money to actually live on.
Yes, and in New York State is kind of, there's something called suitability. We have to be regulated in New York State. Regulation 187, we have to pass a test, and we cannot sell any life insurance products in New York unless we pass that test. And then there's something called suitability, where it's designed to protect the individual, that someone doesn't come in and try to sell them a policy that's $300 a month, but they only have a $1,500 a month income and they got all these other expenses. And they'll come back and say, you know what, based on these incomes and based on her answers or his answers, they really can't afford this policy. The insurance company will come back and say that. So it's designed to protect them. I have never been high pressure. Yes, it's our job to let people know certain information and the benefits of a product, but at the end of the day, it comes down truly to what they really can afford. Because it does nobody any good that they get a big policy because they were pressured, and 2 months later they dropped that policy because they just couldn't afford it. It was a waste of time.
Yeah, it's pretty ridiculous. Because I know that I've had insurance salespeople try to pressure me into increasing it, but And then they'll say things too, like a married couple, well, when one of you dies, one of those Social Security checks goes away.
Yeah.
You know, so whichever one was the highest, I guess,
Yep.
is the one that you keep, that you get to keep. But I remember somebody being at our house one time and with me and Carol, and he was trying to explain all that to us, and he's going, you know, like, don't you worry about that?
Yeah.
And we're going, no. You
Yeah.
know? But I mean, you know, there's things that a person needs while they're alive,
Right.
that they can't spend all of their money on.
That's right.
Insurance. So.
Yes, I mean, that's a valid point to bring up, that the individual is, because they are losing a check, but it all comes down to, if you can't afford the $200 premium, because of everything else, and you're getting to the, you're getting to that line where there might not be nothing left after that. If you can't afford it, then you get what you can, because that's better than zero at the time of death. Mm-hmm. There's never been a family member that has ever said, geez, at the time of death, oh, I wish they didn't do this life insurance. There never has been. But if you can only afford $10,000 or $5,000 life insurance, that's better than zero at the time of death to help the family members take care of things.
Mm-hmm. Well,
Yeah.
I have had to be involved in making funeral arrangements for family members a few times.
Sure.
And what I discovered was that funerals are not as expensive as I thought they were,
Yeah.
you know, before I started having to make funeral arrangements.
It's based on what you want there. It is.
Right. And then also there are things that you can do, like to make them less expensive. I mean,
Yeah.
you know, I'm pretty sure that being cremated is
Right.
a lot less expensive than
Yep.
being buried. And in fact, I have a preference for that idea, because whenever I've been for a family member that wanted the professional or the traditional stuff for a burial, whenever it came to where the undertaker got to talking about not only having a coffin but a vault and all that,
And the cost to just open the ground.
yeah, and you know, it's like it kind of creeps me out, you know, the idea of being sealed underground like that. I
Yeah.
much prefer the idea of cremation. So, oh, you know, we've been hearing on National Public Radio from time to time stories about something new they've come up with. It's called composting.
Really?
There are people who have come up with ideas for composting dead bodies, which seems very creepy if you ask me, but
Hope my wife doesn't hear that. I might end up in the compost pit.
yeah. So anyways, not only that, but I'm figuring most people can earn their own way in life too, as far as the extra money they think that you should take out in insurance so you can leave something behind. Most people's relatives, you know, are earning a living, and they're able to support themselves and everything
Yeah.
anyway. So it seems to be asking an awful lot
Yeah.
for people to.
At the time, I will say, at the time of a funeral, at least to cover the cost, that does take a lot of pressure off the family. That really does. And I'm not talking $150,000 policy or
No,
anything
no.
like that. And again, it depends upon everybody's, partially their lifestyle, the spouse's lifestyle, what their expenses are, can they stay in the home after one passes, losing part of the income. There's a lot of things, but at the very minimum, at least to have that death benefit that can help them for those final expenses.
Right.
Yeah.
That's the main thing.
Yeah.
I one time read a book by that that was written by that famous financial advisor named Susie Orman.
Okay, yeah.
And I remember in the book her saying something about she doesn't even like the idea of life insurance. She said that life insurance was originally invented for something for people to have for the first 10 years of their adult life until they had saved up enough money to pay for a funeral in case they died before they had a substantial amount of savings. So I don't know. What do you think about that? Do you know anything about that?
I have not heard that, but today's times is a little different.
Oh, it is. Yeah.
The cost of everything, and the economy and jobs and everything just a whole lot different than before, and it's unfortunately based on people's circumstances. Whatever happened over their lifespan, there is not a lot of savings sometimes, and a mom or a father will pass away, and there is no money for the funeral.
You know how obituaries usually will name a certain charity or something that people can donate to, and sometimes you can tell when people don't have enough money for the funeral, because they would say that the money could be, any memorial donations could be made to the family or the undertaker for funeral, to cover funeral expenses. So, although I'm not sure that you would get very much that way, but so basically you have to know when you're lining somebody up with a life insurance company, you have to know what their situation is.
Yes. When it comes to Medicare in New York State, we don't ask any health questions. But when it comes to life insurance, it is all about their health. Because what risk is the insurance company going to want to take? A lot of the companies have become more friendlier to diabetics. It's not an issue to get life insurance for diabetics. But if there's complications such as neuropathy and others, and some of those other ones, yes, there can be some issues of getting it. But it's based on their health.
Okay. Now, how do you help people select annuities then?
Well, when it comes to annuities, the area that I work in is those that are getting ready to retire. They have 401ks, they need to roll them over, because once they start getting to retirement age, now it's, for many, it depends upon everybody's situation because everybody is different financially. But based on those individuals that want to now be more conservative with their investment to protect their retirement, because that's what they're going to draw income from, then we roll that over into an index annuity, where their 401k is subject to, if the market drops, they could lose 30%, 20%. In an annuity, an index annuity, it never can go below zero. So they'll never have a loss. They'll only participate in the gains. So I have that area, as well as those that still have certain large sums in the bank or CDs or other vehicles, where they want to protect a legacy for their family members to leave behind for them. And then we go into index annuity. And I have access to products in New York as well as Pennsylvania. I actually have an office in Pennsylvania, in Erie, that sometimes if a person wants a little better product and they don't mind traveling to my Erie office, I can actually get them even a better annuity product.
Oh, that's good. That's good.
Got a little flexibility.
Are there certain annuities that that you specialize in then?
Work a lot with indexed annuities because with an indexed annuity, there's different investment strategies within those that they can choose from. They're conservative, and again, it helps to protect them from any losses in the market. I'm dealing with someone right now, does 63, doesn't know if they want to retire, but their 401k just lost $13,000 in 2 months. And that starts, they see retirement coming. How much more do they want to subject themselves to the risk of the unknown, where we could now get to protect because now it's no more growth period. Now it's protection. We need to protect that retirement.
Yeah, it's a big mistake not to save up money when you're
Right.
younger.
Right.
I sometimes think a lot of young people enjoy going out and spending their money, and
Yes, and
but
2020 hindsight is so much clearer.
and Social Security is very little.
Yes.
So you really do need to save
Right.
money.
Right, yes.
So
Yeah, I haven't looked back in my life, and 2020 hindsight tells I can easily see that I could have done more. Yeah.
Yeah, I can remember being in my 20s and having so little money. I couldn't have, if I'd thought of it back at that time, I couldn't have imagined that we'd be doing as well as we are right now. You couldn't imagine it at that time that you'd have enough saved up. But
True.
if you invest right, you'll be okay.
Yes.
Yeah.
Yes.
So
It's just a matter of time.
right. I would like you to tell the viewing audience how people can get a hold of you if they want your help and to make an appointment with you.
Well, my phone number is 716-296-0022. My website is seniorbenefitsofny.com. We just got it switched over. We're going to put more content on there. Those are two ways. My email is paul@seniorbenefitsofny.com. It's another way to reach me.
Okay.
Yes.
Okay.
If I may just make a point regarding Medicare, going back to Medicare.
Okay.
I get this question a lot. I want people to know I don't charge a fee for my service.
I was just going to ask you that.
I don't charge a fee at all. I can assist individuals to create an account on socialsecurity.gov to enroll in Medicare Part A and B, and I can assist them to do that, as well as once that's established and they get established in Medicare, help them with their Medicare options, whether it's a Medicare Advantage plan or a Medicare supplement, also known as Medigaps. I can help them with that, their prescription coverage. But I want people to know, I get the question all the time, and that's why I started putting on my advertisement down here in Chautauqua County that I never charge a fee, and I could not charge a fee. I couldn't charge someone to sit there and talk about it. It's like charging my parents, and I couldn't do that.
Well, that's very, very nice of you. I wanted to say that Paul, actually, this is we're recording this on the day of the Winter Festival in Mayville, and I actually called Paul on the phone this morning and asked him if he wanted to cancel. This was at 7:30 this morning. It looked like a blizzard
Yes.
outside my kitchen window, and I didn't want to get him to get in an accident driving down here. So we talked it over, but as we were talking on the phone, the weather started to clear up. So
Yes.
he was able to come. He said they were having the same experience
Yes.
up in Buffalo, too,
Yep.
where it had been really, really blizzard-like, and then it had cleared up. So,
If I may make one point, people will see that my office is up in Lancaster, New York, where I live. I am always in Chautauqua County. I service a lot of clients, and I'm thankful to do that down here. A lot of individuals have trusted me to help them with their Medicare. So I don't expect people to come to my office in Lancaster. I'd be glad to come to them. I do it all the time. I will meet them wherever they feel comfortable, whether it's at their home. And believe me, I met people at Tim Hortons or McDonald's. I've met them. When we were able to meet at times, I'd meet people at the Office of Aging. Whether it's more so down in Jamestown, but they got some great people at the Office of Aging.
yes,
here,
they
whether it's,
definitely do.
Bridget here in Mayville, I've worked a lot with, and Christine up in Jamestown with Michelle, as well as Kate Finch in Dunkirk. They got a great organization. And sometimes I'm able to use their offices if they allow, because we're in some different times now. But I never charge a fee, and I can come to them at any time.
Yeah, I mean, that's like these doctors that come up to the hospital in Westfield from elsewhere to see patients
Yes.
in like the Mayville and Westfield area and like that, and that's really nice of them too.
The only
Well,
difference is I won't be taking their blood.
Oh, right, right. Or examining them or anything.
It's true. Yeah, no, I can't do that.
Yeah. Somehow I think this tablecloth got put on wrong. It's practically
I
wanting
think
to
I'm
go
pulling
off
it.
the table. Oh, is that what it is? Okay, yeah. Okay, so we've got like 7 minutes left. If there's other things that you can think of that you probably would like to mention that maybe we didn't cover.
Sure. One of the questions I get a lot, well, there's actually two questions. One is, Paul, after I explain everything, I get, okay, Paul, what should I do? When I sit with someone and we look at plans, they have to look at what their health is, what their current health is. What has the conversation been like with their doctor? Are there any procedures coming up this year that we got to maybe tailor a plan around based on what you might be having done, a surgery, whatever it may be, physical therapy. And then from there, we kind of, if that's out of the question, there's nothing going on, it's really, what do they prefer? What's their preference? What do they feel comfortable with? I don't inundate them with plans. We just kind of talk, and I kind of present some different plans based on what their desires and their needs are. It's not what I think they should have, it's what they need. The other question I get is, if I get this plan, am I stuck in this plan? Can I ever change my plan? And a lot of people don't know that you do not have to wait until annual enrollment that starts October and goes through to December to change your plan. Medicare's got 2 periods you can change your plan. Between October 15th and December 7th is annual enrollment. That's when everybody gets inundated. But Medicare brought back open enrollment. January 1 to March 31st, an individual can change from a Medicare Advantage to another Medicare Advantage plan. They have until March 31st to do that.
Okay.
It's designed to say, that individual, I got sold this plan, you know what, maybe that's not the right plan for me.
Maybe they've had some doctor's appointments and things and weren't really happy with how things turned out.
Yep. Or they go to a doctor and they find out the plan they're put in, my doctor doesn't take the plan. And that happens too. The other thing is, which I'll try to keep brief, is New York State Epic. Now, New York State Epic has nothing to do with my agency or Medicare or any insurance company. It's through New York State. It's a prescription assistance program. And that is a program that could help someone reduce the cost of their prescriptions. But also, Medicare says if you live in a state that has a state-sponsored prescription assistance program and you're a member of it, and that's what Epic is, as long as that person has the Epic card in their wallet, they could call me in July and say, some things changed in my health, I think I need to change my plan. August 1st, they're in a new plan.
Wow.
They don't have to wait till October.
Oh, okay, so.
There are ways to change.
So there are ways to do it,
Yes.
even if it's not during the 2 periods of time that you were mentioning, if it just isn't working out for them.
Right. Now, Epic is through New York State. It's anybody, a married couple, $100,000 of income or under qualifies to be on Epic. Anybody on an income of single, 75 and below, qualifies to get Epic in New York State. In Pennsylvania, they have PACE. It's the income is different with the PACE program in Pennsylvania, but that also allows them to switch once. So if you have Epic, you only can do it once per year to switch the plan, but it could help someone. And many times, based on income, Epic won't cost you a dime to have.
You mean to tell me that you can have an income of all the way up to $100,000 for a married couple and still be eligible for Epic?
Yes. Now, Epic is a prescription assistance. Now, that doesn't mean, though, that as soon as they enroll, so let's say their income's at $90,000, married couple, and they enroll in Epic. It doesn't mean they're going to benefit from lower cost prescriptions right away.
Oh, okay.
Epic will assign them what they call a deductible. Let's say, for round numbers, their deductible is $2,000, and it'd be per person. What that just means is once they've spent $2,000 in copays on their drug plan at the pharmacy for prescriptions, that insulin that was $47 or maybe ended up, or that inhaler that ended up to be $100 in the donut hole or $200, once Epic kicks in, it's no more than $20 the rest of the year.
Oh.
Epic can save you a lot of money, but there's some income there. Anybody that makes $20,000 and less, you're going to pay a quarterly fee for Epic, but if you're not getting any help for prescriptions, then that inhaler, that insulin becomes no more than $15 or $20 a month, right off the bat, right away.
Okay.
That goes for married couple, $26,000 and below. And there's also an income level where Medicare, where Epic will help pay part of your prescription drug premium of your Advantage plan that's built in, or your standard drug plan. I hope that didn't confuse anybody, and anybody that wants to know about that, I'd be glad to sit with them with the Epic brochure. I help people enroll in it. I don't get paid. There's no endorsement. I just do it as a service to help people get into Epic, and it may help them with their prescriptions. For some people, I will tell you, it makes no sense to get in Epic until they may need to change their plan. Then we can get into Epic at that time. There's no enrollment period.
Okay. Well, okay. Yeah, this has been a really interesting conversation, and I do hope that it helps people out a lot. And I want to thank you for coming on and braving the weather, although it has improved some. Although I don't know, when we leave the studio, it might have changed again. So, but anyway, I really appreciate your coming on and sharing all this information with us. And
Sure.
I'll see the rest of you in the viewing audience on the next episode.
Thank you, Gail.
Oh, you're welcome.
Thank you. That was